You're listening to the Public Health Epidemiology Careers Podcast, episode 143.
Welcome to the Public Health Epidemiology Careers Podcast, where we explore public health epidemiology careers and share tips and strategies to help you enter or transition into the field. And now, your host, Dr. Charlotte Hughes Huntley.
Greetings, everyone, and thank you for joining me on this episode. In this episode, you'll meet my special guest, Quinyatta Mumford. Now, in a world of pandemics and epidemics and the unknown, where communities experience trauma or severe life stressors, it is not uncommon for their health to unravel. Quinyatta Mumford, founder of Mumford and Associates and the heart behind the Curvy Consciousness movement, accepts the call to be the change agent. She is a leader, innovator, and pioneer. Ms. Mumford is the founder of Mumford and Associates, an innovative health education and promotion firm that offers individualized, evidence-based, practical, understandable, holistic health education and promotion processes. Mumford and her team provide individual and group health education targeting lifestyle factors through which people at risk or diagnosed with chronic disease can gain the knowledge, skills, and abilities to modify behaviors and successfully self-manage or prevent chronic disease and related complications. Ms. Mumford's great passions are leading the charge on a number of health education programs and serving the state of Arkansas as an epidemiologist. She helps her clients to find healthy perspectives through consulting, research, analyzing statistical data, and delivering positive results. With her educational background and more than 10 years of public health experience, it is without a question that she would be appointed by Governor Hutchinson to the Arkansas Board of Health Education and previously hold the positions of President of the Arkansas Public Health Association and Conference Chair for the Society of Public Health Education. I'm honored to connect that interview with Ms. Mumford right now. Well, today I am very happy to introduce my special guest on the podcast for this episode, Ms. Quinyatta Mumford. Quinyatta, welcome to the podcast.
Hey, it's a blessing to be here.
I'm really thrilled to have you. Thank you for taking out time for this call today, too, because I know you're extremely busy with all that's going on right now. But if you would, let's start out with you just taking a moment to introduce yourself. Tell the audience a little bit about you.
Hey, my name is Quinyatta Mumford. As she said, I am an epidemiologist for the state of Arkansas, currently working on COVID-19. But in my spare time, I'm also the owner of Mumford and Associates and the heart behind the Curvy Consciousness movement. So all in all, I am your certified health education specialist.
Love it. I've been really excited about this interview coming up. So if it's all right with you, I really want to jump in with some questions that I have.
Let's get started.
All right. So let me start with the first question. And I love to ask this because I love hearing about the journey, how you got into public health. So when did you first become interested in public health as a career?
I became interested in public health as a career as a sophomore in college. I was at the University of Alabama in Huntsville pursuing my bachelor's degree in biology. And I actually lost my grandmother to colon cancer. The thing about that is not only did I lose my grandmother to colon cancer, I also lost my great-grandmother to colon cancer. As we, as a family, navigated this loss, I realized that my family lacked knowledge in terms of health and health care and the resources that were available to them. But it resonated with me that it wasn't just my family that had this belief that if a great-grandmother died and a grandmother died, that it was just rooted in your family, and it was nothing that you could do to change to prevent that from happening to other people in your family. So it became very important to me to educate my family about their health and wellness and the things that we were doing that could have potentially been contributing to us carrying a lineage of colon cancer and other chronic diseases such as diabetes and obesity and hypertension. Those were things that my family really believed that we just had to live with. But the fact is that a lot of our family behaviors were contributing to these outcomes within the family.
That's really, I can understand, I can relate to that power, that passion, and that revelation. I talk all the time about finding your passion and integrating that into the work that you do. And for myself, similarly with my family, in terms of diabetes, type 2 diabetes had that impact on my family that you described with colon cancer in your family. And, I also saw where a lot of my family members were just accepting that this is just a part of our family dynamic and just accepting it. And I really, really was, as I learned about public health, wanted to encourage them to take a different approach and realize that there was a lot within your power to kind of affect that direction, So I can
Exactly.
I can really appreciate your passion, that driving passion from your family, inspiring you into this profession and, into what you're doing. So that's really great. You've mentioned your business. I know we've talked about it, but I'd like to dig in a little bit more into your business. So can you tell us about, of course, the name of your business and then more about the purpose, the vision behind your business?
So my business name is Mumford and Associates. It is a health education and promotion firm aimed at empowering individuals to take back control of their health. So I became passionate about the business and starting the business because of my own personal journey. When my daughter was 9, getting ready to turn 10, she told me that for her 10th birthday, she wanted to climb Pinnacle Mountain, which is a beautiful mountain here in Little Rock, Arkansas. But at that time, I was 360 pounds, and there just simply was no way that I was going to be able to do that. But at that moment, because my daughter had something in mind and I just refused to let her down, I committed to taking control of my own health. And so I started to be very proactive about my health in terms of diet and exercise and my behaviors. I navigated this journey on my own in a silo, mainly because I was ashamed and I didn't want to fall off and somebody judge me when I made a mistake. And so I chose to just quietly go along my journey. But I realized that in doing that, I created mental strain for myself because I didn't have an outlet. So what I decided is that Mumford and Associates is about empowering people to look at all dimensions of health, not just diet and exercise, but taking into consideration that where we live, work, play, worship, our finances, all of that plays a critical role in our overall health. And so I want to bridge the gap between what we're told in the clinical setting and what's happening in our day-to-day life. Because a lot of times when we go to the physician, they don't take into consideration what's happening to us outside of the clinic. And so I want to serve as the bridgeway to help people who are recently diagnosed or at risk of developing a chronic disease or battling obesity really figure out what's imbalanced on their wellness wheel and how they need to strategize to move forward in reaching their wellness goals.
That is very powerful. Not only the piece that you said about, the fact that the reasoning that you chose to kind of do this in silence and off to yourself, but also realizing the mental strain and then turning that into, something that you can use to help other people through your business. That's very powerful. And I'm seeing this theme of, where you're turning your pain points into forward progress, becomes an inspiration.
Yeah.
And that's really straight. So can you go a step further and really describe your ideal customers?
So my ideal customer, when we talk about the individual level, I am looking at business professionals that are just really, really busy, that have been recently diagnosed or at risk for developing a chronic disease that's really in tune to the fact that, hey, my behaviors could be contributing to these poor health outcomes. I'm interested in strategizing with those individuals to work within their means. A lot of things that I hear from busy professionals, especially busy professional women who have children, is that I'm too busy to cook. I'm too tired to cook. I don't feel like exercising. I don't want to go to the gym because I'm embarrassed. Or I don't have the resources available within my community to be able to get outside and feel safe. And so I want to help those busy professionals really figure out, how do you continue to maintain professionally, but also take care of yourself health-wise? When it comes to the physician, I am looking to work with physicians that have those hard to reach populations, those populations that have transportation issues, those populations that are going to have resource issues, because again, a lot of what's happening to us health-wise has to do with where we live, work, play, and what resources we have access to. And so I want to serve as a bridgeway to help physicians understand what barriers their clients face that's preventing them from adhering to the recommendations that they're given. But I'm also looking to work with the physician who has poor patient satisfaction. A lot of times patients are dissatisfied because they simply don't understand. They feel rushed and as if they haven't had enough opportunity to understand their diagnosis. And so I want to work with those patients to really help them understand their diagnosis, but also understand that they have a critical role in their health and their health care.
That's great. And that's really, it's important to kind of be able to articulate it on all those levels. And that adds a lot of direction and power. I know that people are listening, maybe sort of self-selecting. I can imagine that someone's listening and maybe on the individual level connecting with what you're saying. And I have a very diverse audience, and there may be several people who are thinking on the community level where they are targeting communities and thinking this is something that could be very helpful.
Yeah.
And even with the physicians, because I know there are a lot of physicians in my audience who may be very well, their ears are perked up right now. So for everyone listening, I will provide you with information and details on how to connect with Quinyatta just shortly. But I do have one, maybe two more questions before we wrap up this episode, and then I can give you all details on how you can connect with her. If it's okay, I'd like to shift gears a little bit. I appreciate you really sharing your heart and your passion for the work that you're doing, really talking about your journey in such a way that I know it's helping people do a little bit of introspective searching to think about maybe their own journeys and maybe connecting with communities and their passion. But I want to switch gears just a little bit and thinking about the audience. I know there are a lot of students and graduates who are regular listeners of my podcast, and they are trying to get into the field of public health. So thinking about current students, do you have any kind of career advice or tips that you would want to share with someone who's interested in careers of public health?
Yes, most definitely. So I mentioned that when I got interested in public health, I was studying at the University of Alabama in Huntsville for my bachelor's degree in biology with a minor in chemistry, which has absolutely, really, I didn't know that would lead to public health. I went on to get my master's degree in community health, but I practiced on a day-to-day basis as an epidemiologist. However, my business is largely centered on health education and promotion. I also do some public health consulting, but I say all of that to say this. As a student, it is very important that, one, you're flexible, that you realize that, hey, you may have to shift as you explore public health opportunities. If you keep your mind open and you're flexible, it'll make it easier to make those shifts. The way that I really formulated my public health career was, one, reaching into myself and identifying those pain points that were important to me. And what could I have benefited from? If I had have had additional support, then that would have made my journey a little less stressful. And so I created a business centered around that. As an epidemiologist, I've developed skill sets that have enabled me to navigate across programs and make an impact. So it's very important that you're flexible, that you're open-minded, that you're real about what you're passionate about and what matters to you, and that you are able to develop skills that are transferable. As a health educator, that serves me well when it comes to epidemiology, because as an epidemiologist, we use a lot of terms that the public normally can't connect with. And so by me having a health education background, I'm able to relate not only to the programs that I serve, but also to the communities that I serve. So be flexible, be open, be real, And then make sure your skill sets are transferable. So a couple of skills that I recommend that all public health students look into is data visualization. So I personally love Tableau. If you can map, that is always an essential skill that people are looking for. So GIS. Coding, you don't have to be an epidemiologist to learn SAS or to learn R. These are skills that will help you not only be able to work with data, but as we get familiar with the data, we're able to communicate it better. And then just always stay in tune to what's happening in public health. Read a lot. I encourage people to just read and think about it. When you're reading these articles, put on your public health glasses and really think about, what does this mean from a population health perspective?
Excellent advice. Excellent advice. I like the way you provided a really good example of yourself, but just being flexible, being open, because often you won't know what you really are drawn to or what you're not until you start taking some actions.
Exactly.
So you start with that natural interest. Like with you, naturally you were, your family inspired a lot of your interests. So once you start taking action, it inspired further action. And I like the way that you're able to also connect, you're able to interconnect the different parts of health promotion, epidemiology. We can't really separate that out. It's all interconnected, and you do a great job of explaining that. So thank you for that.
You're welcome.
So I just want to wrap up by saying thank you so much, because I know that the information you shared will really touch a lot of people across the spectrum, from students to senior level professionals in the field of public health. So I really appreciate you taking the time and sharing that information in this episode.
You're welcome. Thank you for having me.
Well, I really hope you enjoyed that interview as much as I did. I'd like to thank Quinyatta for joining me on this episode to share her journey into public health, details about her business, and for being willing to just share such great career tips for everyone. You'll find links to connect with her on the show notes page for this episode, which is episode 143. Just go to drchuntley.com and click on the podcast tab from the main menu, and then navigate to episode 143. All right, everyone. Until next time, have a fantastic rest of your day.
Thank you for listening to the Public Health Epidemiology Careers Podcast at drchuntley.com.